Hello, everyone, and thank you to each one of you for taking the time out to join us on this webinar. Today's topic is understanding emergency situations in infants. Many a times, as new parents, we are faced with these situations where we are confused on what to do, what should be the next step, and who we should ask. So today we will discuss certain situations and the need that need immediate medical attention. Today's expert is Sushma Jethmalani. She is an
Hello.
internationally certified childbirth and lactation educator. She has been working with ReeLabs for almost 3 years and is a pregnancy and parenting coach on our WhatsApp groups. Over to you, Sushma.
Thank you so much, Arjun. And welcome to all our parents, dear moms and dads. Um, the reason ReeLabs and I decided to do this topic was because this is something which is very rarely spoken of. And we decided that as young parents, moms and dads, they are very anxious. And specifically, if there's an emergency situation with their baby, they get more hyper. And, especially when it's a very small baby, it becomes more difficult to think clearly. And also, sometimes the fact is that you just do not know what to do in these situations. And that's the reason we've decided to conduct this. It's a small education uh, webinar for you. And hopefully, you just take something away from this. So, Arjun, are we good to go or should we wait?
We can start. If someone else joins, we can keep adding them.
Okay, fair, fair. Thank you so much. So, welcome to our webinar with ReeLabs. ReeLabs is a stem cell company, which is I have personally been associated with ReeLabs, and I have to tell you, it's pure pleasure knowing that you know how stem cell banking is done, you know how beneficial it is, and how new parents are actually looking forward to banking stem cells for their babies and their own future also. So with that, let's start. So our topic today is identifying emergency situations. I have been on the WhatsApp groups, I have been on webinars, I have spoken to moms, I have spoken to parents who get scared at anything and everything that affects their baby. It could be as simple as my baby is coughing a lot, my baby is sneezing, my baby is not sleeping well, my baby has not, eaten properly. Is my baby eating properly? The color of poop is like this. Is that okay? So there are like thousands of doubts in parents' mind. And a lot of times, parents do not know what's normal and what's not normal in a baby because, of course, a baby can't tell you that, my stomach is hurting or my head is hurting or I'm feeling cold. So, what happens is that because babies can't tell you, everything sorts of creates a panic in our moms specifically because they're taking care of their babies and they're very worried. Even after vaccination, they are very worried. So this webinar is being done just to tell you, okay, this could be an emergency situation, and this is what you should do. So starting with our introduction is okay. What is a pediatric emergency? What is an emergency which affects infants or babies? So first, it is an emergency known here as a condition which can, of course, threaten the life of the infant. That means that it needs to be like the baby has to go to a doctor immediately or the nearest medical center or a hospital, or you need immediate medical attention. Now it could be anything. It could be something which like can start with a particular illness. Maybe the baby is born with a particular illness and requires help in that. It could be an injury, okay, or it could be maybe just the the baby ingested a foreign object or something which the baby was not supposed to have. And it could be as simple as the baby choking on something, you know. So there are a lot of things and I can understand when a baby goes through any kind of situation where the baby can't even tell you about it, the parents panic. So we are just showing you a few things in which I believe, and the research says that you should just go to a hospital or go to a nearest medical center and just not wait for it to pass, because it may require that kind of medical attention. Coming on to our next slide, what could cause emergencies? It could be persistent high fever. It could be fever, especially in a newborn to 3 months. It could be more than, it could be more than like 101 degrees or whatever. And it's just not coming down. Just not coming down. Okay, irrespective of the medicine and all. Okay, a lot of mothers, when they ask on groups, especially at night, I say at night, we cannot help you here except give you a response. Whenever you feel, and specifically parents and to moms, if your instinct says there's something wrong, follow your instinct. Trust me, mothers and fathers both have that instinct. So some factors that I was talking about was persistent high fever, the fever that just doesn't come down. Lethargy or unresponsiveness. I mean, you feel the baby is, not feeding well, is just like, there's no movement, or the baby is not responding. Breathing difficulties. We'll delve into that. But yes, baby not being able to breathe. Seizures. Seizures are something, where, you go like your body gets seized up. So it's difficult to see in an adult, but in a baby, it's like very, very difficult you can't even watch it. Excessive crying, not feeding. Crying is okay. The baby has cried for some time, then it's feeding, then it goes to sleep. This is normal. But excessive crying, not feeding, not being able to sleep and all, that means there is something which is bothering the baby. Cyanosis, I will describe this later on. Forceful vomiting. So in our WhatsApp groups, we always suggest that babies spit up milk. That is normal. If baby is just forcefully vomiting, like, literally throwing up everything, and if there is blood in it or some kind of green in it, okay, and it happens like really badly, then it's always advisable just rush to a doctor. And sometimes, okay, sometimes there is vomiting. Of course, there's no blood, there's no green. Once it can happen. But if it happens consecutively, like it happens 2 or 3 times, then you have to talk to your doctor or you have to go to a medical center. Jaundice, we all know newborns get jaundice. It's common. There are some kind of jaundices which, slowly heal on their own. But there are some kind of jaundices which require medical attention. And there are some kind of jaundices which actually can go worse. So like, the feet, the hands, the face goes really yellow. Please don't wait for anybody's advice. Just go to your doctor, go to your pediatrician, go to the medical center. Diarrhea, of course, if you feel that, the baby is literally getting, dehydrated because there's so much diarrhea, the baby is not able to eat anything. Bleeding or pus from the stump where the umbilical cord is cut. So if there is any bleeding or pus from there, please take immediately your baby to the doctor. And of course, if there is little or no movement, we don't have to say, just go to the nearest hospital. So coming to cyanosis, I thought a lot of parents may not be knowing about this, but it is actually caused by lack of oxygen in baby's blood. So how you can see is there's a bluish tint to their skin, especially around the lips, the tongue, the gums, and the nail beds. Like their nails become all bluish. That means baby is not having enough oxygen in their blood. And of course, not enough oxygen means there is labored breathing, or baby is breathing very fast, or there is irregular breathing. All these are signs that baby may not be getting enough oxygen. And yes, if the baby is not gaining weight, if there is difficulty in feeding, and they are either unusually sleepy. So now let me clarify over here that newborns up to 3 months can easily sleep from 12 to 16 hours in a day. Some babies sleep less, some babies sleep more. But if your baby is not feeding, not playing with you, or not looking at you, or is so sleepy, or is totally lethargic, please consult your doctor. So this is one of the things that I believe that all parents should be aware of. It is very important for parents to know this is what is causing, and this is an emergency. And you have to take your baby to an hospital. The second thing is fever. A lot of mothers ask, okay, my baby has fever. What is normal body temperature? My baby feels warm to touch. My baby is, sweating. I don't know what to do. My baby's temperature was 98.5. Now it is 99. Should I go to a doctor? This, that. So this is just to let you know that if your baby is from birth to 3 months, you should take a rectal temperature. Okay, so rectal temperature is basically putting the baby thermometer in the baby's anus very, very gently. Okay, and that's the most accurate method for checking temperature of your baby. So you call your doctor if the baby's temperature is more than 100.40 Fahrenheit or 38 degrees Celsius. So what happens is here, you have to understand that after a particular, temperature, your baby is going in that zone. That is where you shouldn't be asking for advice or doing home remedies. It's always best go to your doctor. And if your baby is from 3 months to 4 years, rectal temperature is still the best method. But you can, so 3 to 6 months, if your baby's temperature is more than 101 degrees, and then for 6 months, 1 year, 103 degrees, you should definitely contact your doctor. And of course, as I said on the previous slide, if the fever is persistent and it's not going down, go to the nearest medical center, go to the nearest doctor, approach the nearest emergency center, but don't wait for any home remedies. I know a lot of times we try to put those cool strips, on babies' head, but trust me, for adults it's different. Babies are still very, very vulnerable. That is why it is very important that irrespective of, even if maximum what it will happen is that the doctor will say, okay, I will give medicine, but it's not an emergency. But at least you will be happy knowing that it's not an emergency. And if it's an emergency, you'll be glad that you rushed to a doctor or a hospital. Coming on to our next is breathing difficulty. So if I may say so, I get a lot of questions about my baby's breathing heavily. My breathing, their breathing is snorty. There's a voice coming, snort, sort of. That all is normal. But breathing difficulty comes when there is something like a viral infection. Like baby has an infection and is having difficulty breathing. Of course, there could be heart defects. Some babies are born with that and they have to be taken extra care. Asthma, yes, that could also be one of the reasons. And allergic reactions, maybe some kind of smell or something which is giving them that allergic reaction, that could also happen. And secondhand smoke. That is the reason we always say that please, whoever is smoking should not be near the baby. Okay. And for some reason, if that person comes close, that person has to be very clear about their hygiene. Okay. Because babies can be affected by secondhand smoke also. And pollutants means, of course, if the area surrounding the baby is not clean, there is dust and stuff like that. All these things are going to affect your baby. So, what are the symptoms in this? One, there's rapid breathing. The baby either breathes very fast or the baby is grunting and flaring nostrils, like trying to breathe. The nostrils are like going up and down, or there's a high pitched whistling during breathing, as if the baby is taking a lot of effort to take that one breath. So, when this happens, that means that baby is having difficulty breathing. Again, please no home remedies. I know we all do home remedies, but there are times when you just have to think and you just have to go. So if any of these things are there, please just go to your doctor. Seizure, we all know. Something like seizures are where the baby's breathing pattern changes completely. Okay, there is their inability to focus. So they are not able to focus on you. They are not able to focus on anything. Stiff limbs, of course. There is the limbs become stiff. There's no movement. There's unusual movement of the eyelids. The eyelids are not blinking properly, or they are just, they are not able to, they are very unusual movements. Like they are, the baby is not moving the eyelids how it normally would. And of course, limp and unresponsive. Limp means the body has gone completely limp. It's down. The baby is not responding to anything you say or anything you're doing. These are all seizure symptoms. Rush to a medical center. So I have till now given you a lot of things about what are the things that can affect babies. When I come to my, so this is basically a snapshot, like when to go to an emergency. So one, of course, I told you, if your baby is less than 3 months and has a fever, okay, has a purple or red rash that does not turn skin color when pressed. This is rare, but yes, it is still one of the signs. The baby is frequently vomiting or vomiting green fluid or blood, which I told you, has difficulties breathing, is drinking less than half the normal, and also not passing urine every 6 hours. So this is one of the things that I tell my mom, that if your baby has not passed pee count since peed since 6 hours to 7 hours, just go to a doctor. Okay. And of course, yeah, some of them are for elder children, like they have severe headaches. Okay. Or they have a lump or a swelling. And of course, which I told you also, that if there is a pain medication which is not helping the baby, go to an emergency center, because your doctor will tell you exactly what's wrong. And frankly speaking, I believe that the fastest that you approach the medical center, the more easier it will be for them to sort of get a cure for baby and take care of the baby as fast as they can. So some of the things that you can do as a parent, first of all, educate yourself about what's normal and what's not. So this webinar is basically to to tell you what's normal, what's not. So I told you, okay, if forceful vomiting happens, but baby is fine after that and it's vomited only once, that's okay. But if it happens again, if there is green fluid in it, if there's blood in it, that's not okay. So all parents should know what's normal and what's not normal. When we do these webinars, basically this is to educate all our parents. So stay calm to think clearly. So God forbid if any of you parents are encountering this situation, and if you've gone through this webinar, you will be able to remember, okay, this is what is okay, but this is not okay. Just let me go and talk to a doctor or go to a hospital. The reason, again, as I said, the reason for these webinars is because of these things. So what happens once you're educated? You can actually stay calm, think clearly, okay, this is what I had been told. And if the baby is crying continuously, the first thing I think you should check for, and I think basically any mom would check for, is okay, is there any clothing? Is there anything, a diaper pin or anything that pinching the baby? First of all, mothers will check that. They'll open the baby, they'll open the diaper, they'll try to check everything. Nowadays, of course, diapers have this very good Velcro thing where you don't have to put pins and all, but of course, there are still, moms who may be using that. But they'll see if there's anything which is hurting the baby first. So, first of all, you have to do that. You have to see if there is any physical problem. There may be something below the baby which is hurting the baby. There may be something something like on your lap, which you don't know, but it's hurting the baby, or a pointy pin. Check for fever, and if above 101 degrees and baby is 3 to 6 months, call doctor immediately. I told you a listlessness, there is no strength in the baby. The baby is very lethargic, the baby is unusually sleepy. Okay, or listless means the baby, you can't see any movement in the baby. Please go to the emergency center. In case of seizures, don't even think about it. Just go to the emergency center or a hospital. Now, these are all the things which I tell you in case your baby is in an emergency. But there are a lot of times that we can protect our baby from these emergencies. So, of course, we all are parents, we love to take care of our babies, but we still let go of some things. So these things I believe are very, very important. So please collect the vaccination chart from your pediatrician and see to it that the vaccinations are given to the baby on schedule. They are very, very important. They actually protect your baby from a lot of illnesses. Breastfeeding your baby. Breastfeeding has a lot of good things, and breast milk is actually very good for your baby, and it actually protects your baby from a lot of illnesses. So if you can, please breastfeed your baby. Healthy diet. Your healthy diet will help the baby grow. So we always say that take care of the mom, you will be able to take care of the baby, because the mom takes care of the baby, breastfeeding. A lot of times, of course, nowadays fathers are very, very hands-on, but breastfeeding, making the baby probably sleep and stuff like that. So I would suggest take care of your diet. So obviously your baby is taken care of. Good hygiene practices. As I said, wash your hands before sort of handle your baby. If you are sick or anybody else is sick. Now, if a mother is sick and she wants to breastfeed a baby, we say yes, but please wear a mask, wash your hands properly, okay, and then feed your baby. But if somebody else is sick in the family, please keep them away from your baby till that person gets better. It's very, very important. Another thing is that good hygiene practices is, of course, Also, the fact that, even keeping the baby clean, keeping yourself clean, these are all things that, you know, and of course, if there's a visitor coming, please hand them a sanitizer or something, or tell them to avoid touching the baby, you know, at least till if at least till the baby has started getting their vaccination properly and stuff like that. Regular medical checkups, please do that. Please follow up on regular medical checkups, so your pediatrician will check whether the baby is gaining weight properly, whether the baby is developmental milestones are going good. Safe environment, of course. You have to take care of your home. So the baby has to have a separate crib. The baby has to be in a room which is safe. And safe sleep practices is, yes, baby in the same room but on a separate cot, which is only made for the baby. And yes, smoke exposure, I have said, secondhand smoke and all is very bad for the baby. Please keep smokers away from the baby. Trust me, you want this. Monitor for symptoms. Of course, you'll have to see that, okay, so I told you a lot of things which can happen, like quick breathing, rapid breathing, or babies having difficulty feeding. So keep on monitoring for these symptoms. Some of the symptoms you can see, some of the symptoms you may not be able to see, but if you have it in mind, trust me, you will be able to. And keep choking hazards away, so like small toys and stuff like that, which can get stuck in baby's throat. Please keep them away. So see to it there are no loose toys in the baby's crib, or loose blankets also, or use sheets also, pillows also. No, please keep them away. So these are all the things you can actually do to protect your baby from these danger signs. The rest, of course, I have already told you that you can rush to the emergency center, but at least you know that you did your best by actually protecting your baby from all these danger signs. And finally, I do not know how many parents know about this, but sometimes till the, God forbid, till the ambulance is coming or till you reach the hospital. This is just an example. This is just the one of the things which I just wanted to include for our parents. CPR. CPR for infants is, it's something which may, God forbid, you may never have to use, but if you ever have to use, this is how CPR is done for infants. And you, of course, if you want to learn more about it, then we can, you can always contact me. But CPR for infants is very same. So first you check your baby for breathing. Check your baby. Heartbeat, nose is the air. If there is no breathing until the time the ambulance is coming, or the help is coming, find proper position and start pushing down on the breastbone. This is our breastbone. So give 30 compressions over here. Okay, push, push, push. And the third step is you open the baby's airway using the head lift and the chin lift method. So you're opening this airway of theirs. Okay, and then place your mouth on the baby's nose and mouth and start breathing and start giving them 2 breaths. This is CPR. It's something very simple. This at least you can try till your doctor or your pediatrician or your hospital arrives. I do not know how many parents know about this, but I believe that this is something every parent should know. So with that, I wanted to wrap up on this session. And thank you so much for attending this webinar. Thank you.
Thank you so much, Sushma, for this really, really informative webinar. And as a new parent myself, I really found this very educational. So
Thank
for
you
that.
so much, Arjun.
So now we open this for questions. So if anyone has any questions, you can unmute yourself and ask, or you could even ask in the chat, and then we can ask the Sushma to answer those questions. So please feel
Definitely.
free. Any questions anyone has, please feel free.
Hello.
Yes, hi, we can hear you.
Yeah, hi. Sunny Suryavanshi.
Yes, sir.
Can you speak a little louder, please?
Can you hear me now?
Sunny, we can't hear you. Can you speak a little louder, please?
Can you hear me
Otherwise,
now?
he can put his question on the chat.
Yes, you could also put your question on the chat.
Hello?
Yes.
Yeah. So, good evening, everyone, and a very wonderfully conducted session, ma'am. I have a question for you, which is there any particular, are there any tips that you can share if, like, during monsoons, because we are in monsoons right now, if, you can share some tips for parents of how to take care of newborn babies during monsoons, because monsoons, like, kids are, like, every one of us are, like, quite vulnerable to get, infected or, like,
Yes, yes, yes. Unfortunately, Mr. Sunny, right?
Yeah.
Yeah, you're absolutely right. I've just come from a place now from a gathering, unfortunately, where there were literally like out of maybe 30 people, at least 10 were having viral infection.
Okay.
Yeah, so the first thing, as I suggested also in my webinar, was that first of all, please keep such people away from your baby.
Okay.
That's one of the most important things, and I think that is literally the most important thing you can do. Now, mothers, of course, would like to feed their baby, so we always push for, like, you know, have wash your hands, keep a sanitizer, wear a mask, and then you can breastfeed your baby or handle your baby. And of course, I would suggest that besides keeping these people away from your baby, the other thing you can do is you can keep your environment very clean. So there shouldn't be damp things in the room. Unfortunately, a lot of times we put clothes to dry in the home, right? So even if you're doing it in your hall or stuff like that, please don't put it in baby's room. Okay, those are the things that you can take care of. And you can also put like a humidifier or something like that in your baby's room, and also you can just taking care of hygiene, you can just maybe wash your baby's clothes separately, and
Okay.
so then with a disinfectant and with baby's whatever washing liquid and all. So these are all the ways that you can actually protect your baby from these monsoon diseases.
Okay. Thank you so much. I have one more question. Like, considering the weather and temperature, what is, like, ideally the temp? I mean, we all use air conditioners in our homes nowadays. So, what should be the ideal room temperature for a newborn infant?
So for a newborn, around 25 degrees is good.
Okay. All right.
And
Thank you so much,
that
ma'am.
would be most welcome, most welcome.
Thank you, Sunny. So we have one more question from Amrita, and she's asking, what is the armpit temperature for a 0 to 3 month old baby?
So are you talking about fever or what?
I'm guessing normal temperature and fever. Like I think sometimes they said that the armpit temperature is different than the forehead temperature. So
Yes, it is. It
yeah.
is the rectal temperature. That's the reason I suggested that please take the rectal temperature. Okay. And otherwise, it is normal. Like it has to be usually armpit temperature is not very accurate in a 3-month-old baby, till they are 3 months. And, if they are a little above 3 months and all, slowly, but it should be below 99.
Thank you.
Any more questions?
I like both the questions that were asked were actually quite useful questions. I mean,
Ideally, yes. No, but
Hello.
Yeah, hi,
Yes.
we have, I think
Hello.
Amrita has another question.
Yeah,
Yes,
hi.
Amrita, please.
This
Hi.
is Amrita. Thank you, ma'am. Thank you so much for this informative webinar. I have another question actually. That's my baby is actually constipated. He is entirely on breastfeeding, almost 2 months now, but
Okay.
he is quite constipated. So, is there any solution?
Have you so your baby is feeding well?
Yes, he's feeding well. His pee count is fine, like whatever as per the doctor's guideline.
Constipated means
Uh,
since how many days have your baby not pooped?
or he is pooping after almost 4 to 7 days interval, and even after that, it's like it's poop is very hard. I mean, he is literally crying while pooping.
Okay. Uh, sometimes Ankita, right?
Amrita.
Amrita, sorry. So Amrita, sometimes it so happens is there is something in your diet which may be
Mhm.
causing constipation because the baby is completely breastfed. And another thing
It
I
might
would suggest,
actually.
sorry.
Mhm. Yes. Actually, as per the pediatrician, I'm taking almost at least 3 to 4 liters of water intake in my diet already,
Which is good.
but still, it's not helping.
Oh, so another thing I would suggest is that try giving a little tummy massage to your baby, okay?
Okay.
Specifically when your baby is trying to poop, okay? And when the baby is comfortable and playful, please give tummy time to your baby because that helps a lot in constipation. And then, you all also have like this, your baby's, lying down and you can just, sort of cycle your baby's legs a little, give them tummy massage, and then when you put them on your tummy time, all this helps them with their bowels. So you can do that.
Okay. Thank you, ma'am.
Most welcome.
Thank you, Amrita. Sushma, I have one more question from one of our group chats. The question is, suppose a mother who's breastfeeding has a cold or cough, how is she supposed to, breastfeed her child without trying to pass on the cold or cough to the baby?
Okay. So cold and cough, of course, she has to wear a mask. Always suggest wearing a mask, because then that is something. And because, and we never tell our moms who have cold and cough to stop breastfeeding their baby. So that's, they can still continue breastfeeding, but yes, cover their, face with a mask when breastfeeding, wash their hands, sanitize their hands while handling the baby. Until they are not really that well, maybe somebody can support them and help them take care of the baby till they also get better. So the less they handle is better. But if they have to handle, then yes, just take care of your own sanitary hygiene practices. That's all I can suggest to a mom.
Thank you.
Okay.
Does anyone have any more questions? So I think we can end here. Uh, I think it was a very, very informative webinar. Thankfully, you did cover a lot of it, so I'm guessing everyone's already quite
I hope
knowledgeable
our
about everything.
parents got a lot of information from this webinar. Okay. And as I said, God forbid, but I hope, thank you, Mitali. And I hope that this never happens. But yes, if it happens, I really wish that this webinar helps you and you actually can, talk to your doctor or go to the hospital in time. And I hope it genuinely helped you. And in the end, I just wanted to say that so I'm actually a certified childbirth and lactation educator. And if any of the parents or any of the pregnant moms or anybody would love to have some prenatal, postnatal classes, you can get in touch with me. I will leave my number.
We have also left Sushmaji's Instagram on the chat. And we will also be uploading this on YouTube. So anyone who's missed this can always go over and, view it there. So your information will be there as well.
This is only for our ReeLabs parents. So in case they want to get in touch
Yes.
for any postnatal classes or any consultations, okay, this is my number. They can directly DM me. Thank you. Thank you so much. I'm
Thank you so much,
genuinely
Sushma.
very happy.
And
you.
thank you so much for everyone who joined us for this webinar. Thank you so much.
Thank you. Have a great weekend.